Red mold disease, caused by the fungi Monascus purpureus, which is often used to produce red yeast rice, was first described in the scientific literature in 1998. The disease can occur when red yeast rice is contaminated with citrinin, a mycotoxin produced by several species of the genus Penicillium, Aspergillus, and Monascus itself. The contamination can lead to severe health issues if consumed. The recognition of this disease highlighted the importance of controlling fungal growth and mycotoxin production in food products, especially those involving fermentation processes. Red mold disease is primarily associated with the consumption of contaminated red yeast rice. Red yeast rice is created by fermenting rice with the mold Monascus purpureus, which produces a characteristic red coloring. This product is commonly used in Asian cuisines and traditional Chinese medicine. The primary route of infection or health impact from red mold involves the ingestion of red yeast rice that is contaminated with high levels of citrinin, a mycotoxin produced by Monascus species as well as by other fungi like Penicillium and Aspergillus under certain conditions. Citrinin can cause kidney damage and other health issues when consumed in significant amounts. It's important to note that red mold disease isn't an infection in the typical sense, such as those caused by pathogenic bacteria or viruses, but rather a form of mycotoxicosis, poisoning by fungal toxins. The critical factor for avoiding this condition is ensuring that red yeast rice products are manufactured, stored, and handled under conditions that minimize fungal contamination and mycotoxin production. Red mold disease results from consuming red yeast rice contaminated with the mycotoxin citrinin, primarily produced by Monascus species as well as other fungi like Penicillium and Aspergillus. The disease predominantly impacts kidney function, manifesting through symptoms that indicate renal damage such as increased creatinine levels, the presence of protein in urine, proteinuria, and in severe cases, potential kidney failure. This condition underscores the nephrotoxic nature of citrinin, which targets and disrupts kidney operations. Beyond the renal implications, individuals affected by red mold disease may also experience a range of gastrointestinal symptoms. These include nausea, vomiting, abdominal pain, and diarrhea, which arise as the body attempts to eliminate the toxin. In some cases, liver function may also be compromised, evidenced by hepatotoxic effects such as elevated liver enzymes and jaundice, although these are less commonly reported. General symptoms such as malaise, fatigue, and weakness are also associated with citrinin exposure. These nonspecific symptoms reflect the systemic impact of the toxin and can complicate the diagnosis due to their commonality with other medical conditions. Given these potential health risks, it is crucial for red yeast rice products to be rigorously tested and monitored for mycotoxin contamination to ensure safety and prevent red mold disease. Individuals experiencing any of these symptoms should seek medical advice promptly to receive accurate diagnosis and appropriate treatment, emphasizing the importance of medical oversight in cases of suspected mycotoxin exposure. Treating red mold disease involves a multifaceted approach, primarily focused on alleviating symptoms and preventing further toxin exposure, as there is no specific antidote for citrinin poisoning from contaminated red yeast rice. The first and foremost action in managing this condition is the immediate cessation of consuming the contaminated product, which stops further intake of the toxin. Upon suspecting exposure, it is crucial to seek medical attention where healthcare professionals can conduct a thorough evaluation. This includes tests to assess kidney and liver function, among other vital parameters, to gauge the extent of damage caused by the toxin. Supportive care plays a central role in the treatment regime, where maintaining adequate hydration is key. Hydration helps flush the kidneys and supports the body's natural mechanisms to eliminate the toxin more efficiently. Symptom management varies based on the affected organs and the severity of the symptoms. For gastrointestinal distress, such as nausea and vomiting, appropriate medications may be administered to provide relief. In cases where there is significant kidney damage, more intensive interventions like dialysis may be necessary to support kidney function until recovery is possible. Continuous monitoring and long-term management are essential components of treatment, especially to address any ongoing or chronic effects of the toxin. Regular follow-up appointments, blood tests, and urine tests are crucial to ensure that the body is recovering and to manage any persisting organ damage. Additionally, Preventive advice is often provided to patients and the general public, highlighting the risks associated with unregulated supplements and the importance of selecting products from reputable sources. This educational aspect is vital to prevent future cases of mycotoxin poisoning and to promote awareness about the potential dangers of contaminated food products. Through a combination of immediate action, supportive treatment, and preventive education, the adverse effects of red mold disease can be managed effectively, although recovery can vary depending on the severity of the initial exposure.